Introduction. Lumbar puncture is the introduction of a hollow needle into the subarachnoid space of the lumbar portion of the spinal column to diagnose suspected infection and remove blood or pus. Continued. Cerebrospinal fluid, CSF, is completely replaced about 3 times a day. Although about 500 milliliters of CSF is formed every day, much of it is reabsorbed into the blood. There are about 120 to 150 milliliters of CSF in the system at any one time. Indications. Symptoms of fever, malaise, and central nervous system irritability. Contraindications. Lumbar skin infection. Platelet count less than 50,000/μl. Degenerative joint disease. Increased intracranial pressure. Complications. Severe headache. Meningitis from introducing bacteria into CSF. Back or leg pain/paresthesia. Accidental puncture of spinal cord. Accidental puncture of aorta or vena cava. Herniation of brain due to sudden decrease in pressure. Equipment. Spinal tap tray. Mask. 22 to 23 gauge needle. Syringe. Manometer. CSF specimen collection bottles. Skin spray. 1% lidocaine. Povidone iodine. 22 gauge spinal needle. Sterile gloves. Fenestrated drape. 2x2G. Procedure. Position client in tripod, fetal, or lateral recumbent position. Have client clasp hands on the knees. Draw a line across the back, between the top of the iliac crests, locate the interspace between either L4-5 or L5S1 mark, with barrel of syringe. Open the spinal tray. Continued. Put on sterile gloves. Cleanse the skin 6 inches around the interspace with povidone iodine in a circular motion. Cleanse the same area with 70% alcohol. Draw up 3 milliliters of 1% lidocaine. Assemble the manometer with the 3-way stopcock. Continued. Inject the lidocaine at the site, raising a wheel in the skin. Inject 0.5 milliliters of lidocaine into the posterior spinous region. Insert the spinal needle with stylet in place through the skin, just below the palpated spinous process. Angle about 15 degrees cephalad. If you hit bone or the needle meets with resistance, withdraw the needle slightly and redirect. Advance the needle slowly. Continued. After the needle is inserted a few millimeters, withdraw the stylet to see whether CSF is present. You may hear a popping sound when the needle penetrates the dura. Advance the needle 1 to 2 millimeters farther. Remove the stylet. Attach the manometer to the hub of the inserted needle. Note the level of pressure on the manometer. Continued. Open the stopcock to allow the CSF to flow into the test tubes. CSF collection usually takes 5 to 10 seconds. Do not attempt to aspirate CSF with a syringe. If blood returns, remove needle and discard. Repeat procedure with fresh needle. Remeasure level of pressure. Do not withdraw CSF if pressure is significantly different. Label the tubes. Continued. When enough CSF has been obtained, replace the stylet and remove the needle. Spray the skin. Cover the insertion site with a 2x2 pressure dressing and leave in place for 2 hours. Send tubes to laboratory within 2 hours for analysis. Do not refrigerate the tubes. Client instructions. To prevent a headache. Have the client lie still for 4 to 8 hours after the procedure. Encourage fluids by offering at least 1 to 2 8-ounce glasses of water. Popsicles are often a great substitute. Ask the caregiver to assist the client with activities, and have the client rest while lying down over the following 4 to 8 hours. Have the client avoid strenuous activity for first 24 hours after procedure.